Allergies in the air this time of year. It seems to make our dry eyes even more problematic. Dr. Whitman of the Key-Whitman Eye Center joins me this morning out on the patio, socially distant, of course, with some solutions. It's great to see you.
Great to be here this morning, live once again.
I know. It's small steps, but we're taking them. Now, what is dry eye?
Well, first of all, what a lot of our viewers probably don't know is that dry eye can be a really severe problem, and for many patients it means lifelong treatment. And to understand dry eye, we have to understand the tear film that lubricates the surface of our eye. It's made of 3 layers: an inner mucus layer that covers the surface, a middle watery or aqueous layer, and then an outer lipid or oil layer that stops the other layers from evaporating off the eye immediately. And you can tell if any of these layers gets out of balance, we're going to have dry eye symptoms.
Now, I love asking you this, Dr. Whitman. I want to ask what the symptoms are, because I imagine it's having dry eyes, but on top of that, what else?
Well, people can often feel itchy, burny, feelings like they have an allergic problem, but it's not. It's dry eye. Gritty, foreign body sensation, red, irritated eyes. And a lot of patients will tell me, Dr. Whitman, my vision fluctuates. I blink, it clears up. I blink, it gets blurry. That can be dry. And Alana, I bet you didn't know that people with severe dry eye can pour out tears. Excessive tearing we call reflex dry eye. And they're pouring out a watery tear that unfortunately doesn't lubricate well.
It's kind of the opposite, huh? Yeah, but it is still dry eye. Now, who is affected? Maybe somebody who has really bad allergies?
Well, that can be the problem, particularly this time of year when we're starting to get a lot of stuff floating around in the air again. And really anybody can be affected, but most of our patients with dry eye are 50 years of age and older, more female than male. There's probably some chemical or hormonal influence over that. We can see certain medications like antidepressants and antihistamines can cause dry eye by drying the tear film. And we're seeing a lot of younger people with contact lens problems. They'll come in and say, hey, doc, my contact lenses are just so uncomfortable to wear now. It's not the contact, it's dry eye.
I see. All right, well, there's all the bad part, but there are solutions. Talk to me about some treatments.
Well, we can make it better. The mainstays for simple dry eye are often artificial tear preparations, tear gels, and tear ointments, depending on what layer of the tears are affected. Unfortunately, it's not the kind of thing you can pick up on the grocery aisle, but we can make specific recommendations about that. For more moderate dry eye, we recommend supplements like I have Hydro Eye here, and it's a nutraceutical, like a vitamin that you take that improves the content of the tears. And for more chronic, severe dry eye, we actually have some really great new treatments that help with that oil film part that we were talking about. It accounts for most dry eye, and we have treatments now that are directed towards that.
Let's hear about that.
Well, since most dry eye is caused by clogging of those oil glands that lie along the edge of our eyelids, we have treatments like Lipiflow, IPL, intense pulse light therapy, and ILux, all which are directed to warming the secretions of the eyelid and expressing those clogged glands and normalizing that tear film. And we can get almost immediate improvement, and that improvement can last for 6 to 12 months. And I have dry eye, and I've had all 3 treatments performed in the past, and they work.
Is this covered by insurance?
Well, unfortunately, insurance doesn't cover these treatments, but at Key-Whitman, we've made them very affordable, and my chronic dry eye patients tell me the cost is well worth it. And as I say, it's long-lasting, and it's painless, and it doesn't take long to do.
Dr. Whitman, I know you have locations all over North Texas also.
We do. We're all over the Metroplex, but for the dry eye center treatments, this is only at the Plano office and our headquarters office where my staff and I are.
Okay.
When you make your appointment, either on the phone or online, let us know you're coming in for a dry eye issue, and we'll make sure you get scheduled at the right location.
All right, very good. If you have any questions, though, my suggestion is to give them a call, but I'm going to give that information to you one more time. The IPL and the Lipiflow are available in Dallas. The ILux is only available in Plano, but if this is confusing or you didn't catch it, it's fine. Get this number, write it down, give them a call. It's 214-220-3937. That's 214-220-EYES. Very simple to remember. Also, their website, keywhitman.com, to schedule an appointment. Paige?